Hi everyone, we are fortunate to be joined by Dr. Susan Lelko from ProHealth Physicians, and she's going to answer some questions that parents might have about COVID-19. I think many parents are concerned about their children getting COVID-19, but specifically new parents. Do you have any advice to moms about whether or not they should continue breastfeeding their children?
So absolutely, even during this time, new moms should breastfeed their babies. When they're breastfeeding, they're passing antibodies to the baby that does help protect them from certain illnesses. If they're feeling sick, they could wear a mask. They definitely should wash their hands really well. And if they're just feeling too sick to physically breastfeed the baby, they can pump. Again, they should wash their hands well, sterilize their equipment. And they also should know that perhaps their milk supply might drop a little bit. And if that happens, just reach out to your provider or to a lactation consultant.
If parents are concerned that their children or child might have COVID-19, what are some symptoms that they should be looking for?
Fortunately, during this pandemic, in pediatrics, we got a little bit lucky in that most children are presenting with minor illness. They're presenting with symptoms of a cold, like a runny nose, stuffy nose, cough, or sore throat. And some children are also presenting with diarrhea.
How does getting a test work? Do they call their primary care doctor? What steps should they take?
Those guidelines are changing quite fluidly like the rest of this situation. My suggestion would be contact ProHealth. We can order testing for you depending on the symptoms and depending on where you live. At ProHealth, we have drive-through testing sites. You won't even have to get out of your car or further expose your family or other family members.
How important is telemedicine right now? I'm sure many parents are wondering, should I bring my child in? Should I stay home? What do you think some of the benefits of that are?
Telemedicine is so important at this time. We are trying very hard not to bring people into the office when it's not necessary to help prevent the spread of this illness. At ProHealth, we've adopted a telemedicine platform. So you call, you set up a video visit, talking to you and actually seeing you're making a good assessment and hopefully keeping them from going to an emergency room or even coming in the office.
Now, if a child is sick, but they're not exhibiting symptoms associated with COVID-19, what should parents do?
Many providers will do a telemedicine visit or they'll just handle it over the phone. We are all open for business and there to help you in any way that you need.
What are some ways that parents can keep their children healthy during this time and also keep their home clean and safe for them too?
You want to make sure your child's getting plenty of sleep. You want to make sure that they're eating a really healthy diet. You want to make sure they're drinking lots of water. When you're at home and you're doing remote schooling, you can have them stand up and do like an exercise break or a dance break. And then when it's nice out, get outside with your family and your children and exercise and get the fresh air. We're very fortunate in today's day and age that we can still stay quite connected even though we can't physically be with each other. So encourage children to do video chats with friends and family. A lot of the schools actually are setting up social platforms for the children to interact. If you find yourself in a situation where your daycare is closed, you should reach out to friends and family that you trust, set up a system with them every day, make sure that they're still following social isolation and that they are healthy before you drop your child off. We know this is a really difficult time for families in many ways. Lots of parents are having two parents trying to work from home. The kids are doing their remote learning. Possibly there's infants and toddlers around that just need constant attention. It can be quite demanding. So you should set up structure and routine, but also we really suggest you take this time to reconnect and just enjoy each other as a family.
Well, Dr. Lelko, thank you for your time. And if people want more information, they can go to prohealthmd.com.